I know physical therapists that have been around for 30 years, most amazing physical therapists on the planet, and they can't produce patients.
Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Well, hey there. Welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from Rehab Practice Solutions. So, you should have received an email if you're on the email list, but we got an official web page up for the podcast. It's taken 2.5 years. The domain has basically lived on a URL redirect in my hosting server for years, 2.5 years. And I always thought, man, I'll get around to making like a dedicated page for the website, for the podcast, separate from the Rehab Practice Solutions website. And I just never got around to it. Well, I had some time on my hands, decided I'd throw it together. So you can check that out now at www.betteroutcomes.show. It's super simple, but hey, it's a home for the podcast nonetheless, right? Well, this week we are talking about, I'm totally taking this term and using it from him now, ecosystem mergers. So Andy Zapata is an occupational therapist down in Florida, and he is the CEO and founder of Physical Therapy Now. They're one of the fastest growing PT and OT clinics in the country, to my understanding. And he and I have a discussion around growing your healthcare practice, leveraging relationships. So instead of doing what many people do, which is you show up at a doctor's office or a referral partner's office and you basically act as a supplicant, begging for the scraps that fall from Longshanks's table, so to speak. Begging, please give me some referrals, give me patients, I need patients. There's a better way to do it, and Andy shares about that in this episode. One of the big things that he talks about revolves around this idea of ecosystems and ecosystem mergers. So if you think about yourself, you have your little ecosystem, and it might be your sphere of influence, and the doctors have their own, or the referral partners have their own sphere of influence. And how can you merge them so that you are, in a sense, bringing value and creating more value than simply going with your hand out and asking for patients or referrals? So it's a pretty interesting topic, or pretty interesting concept. I'm glad he brought it up. Andy is a very well-accomplished occupational therapist, business owner, and entrepreneur. And it's always great to sit down and talk with people like that are doing just really cool things in healthcare. And specifically because I'm an occupational therapist myself, it's nice to connect with other OTs, expanding the scope of what we are able to do as a profession. And this franchise and the way they approach care is really just great. I like the idea of, again, individualized treatment planning, improving clinical outcomes. He talks a little bit, I don't know if we shared this in the podcast or not, but they have their own EMR, and we talked offline for sure about how they're leveraging that data to improve clinical outcomes and patient engagement and retention in their own practice, which is, again, something super cool. So without further ado, here is Andy Zapata talking about building your healthcare practice by leveraging real relationships. Well, hey, Andy, welcome to the show. How are you?
I'm doing amazing, my friend. Happy Friday.
Yeah, happy Friday. I'm excited about talking primarily about building businesses and leveraging relationships to grow those businesses. But before we dive into that, tell us a little bit about yourself, who you are, what you do, and then what brought you to doing physical therapy now.
Yeah, I'll tell you a little bit about the history. I'm an occupational therapist by trade. I graduated in 2003 from FIU. So FIU alumni. Awesome. Down here in South Florida, in Miami. And, off the beginning, off the rip, I opened up my first physical therapy center. And it was very challenging to understand the systems, the processes, and nobody really gave me the formula of how to do things. Nobody said, here's the blueprint. I would have to go around asking friends, and everybody would give me like, hey, fill out this form. This is how you do billing. This is how you do collections. And it really took me about 3 years to understand how to run a efficient physical therapy practice. And it was really asking so many people. And some people I paid for consulting, and some people just told me because I would ask them. But the challenge was just understanding how to run an efficient physical therapy practice. Back in 2006, I started selling physical therapy centers because I said, wow, these things are very lucrative. Like, people are giving me 100,000, 80,000, 150,000 for a practice that was just a shell. And so I was selling physical therapy centers. I would get all the insurances. I would get the Medicare, the Medicaid, and I started selling practices. So I was like a broker selling practices, which was amazing. I sold about 40 of them between 2006 and 2010, and made a lot of money selling practices. And then I started doing a little consulting, but nothing big. And like, I would say, hey, I'm going to help you out for 3 months, and then I'm gone. I got to run my own practice. And I would give them some consulting as part of the sale. Nothing big. About 2015, we had it all. I had everything. I had the home, the cars, the babies. I was super satisfied with my life. And I was like, what's next in my life? And that's when I decided to say, hey, you know what? Maybe I should, with what I know how to open clinics. I know how to open physical therapy centers. I'm very successful at mine. Maybe I can teach other people and still hold a piece of the entity, of the piece of the company. And maybe I can do a franchise. And I looked into some of the other franchises. At this point, there was only 2 of them because I was interested in joining them. And I looked at them, and to this day, they're friends of ours. And I look at them and I said, wow, these people are doing pretty cool stuff, but they're not doing what needs to be done to really make this successful. They are very good at selling franchises. So, we're going to do this, we're going to do that. And then comes to it, you got a beautiful location, but you have no patience. So I said, you know what? I can do something better because I know something that they don't know. And I'm going to drop in with some content today, which is about building relationships. How do you really get the business, which is one of the pillars of running your practice. And I think in the last episode, we talked about 3 pillars, which are: how do you perform the service? How does the environment look in which is what you're good at? How do you perform the service? What kind of energy? What kind of questions? How does your facility have to look? What kind of music? What kind of energy needs to be around there? The second pillar is, what are the systems? What took me 3 years to figure out? It took me 3 years to figure out what are the right systems that I have to run an efficient practice. And that's what we call the systems, the protocols, the operation. And the third part is, you can't survive without patience, without sales. Nobody can. So like I said in my last podcast, I know physical therapists that have been around for 30 years, most amazing physical therapists on the planet, and they can't produce patients. And why? Because they don't have the skills to develop relationships. And that's plain and simple. And I believe that every single business is built on relationships. Every single business is built on relationships. I don't care who it is. And every single relationship, think of your wife or your girlfriend when you met her. Every single relationship was built on one thing, and that's called an experience. First, you invited her to coffee. Then you said, let's go to dinner. Then let's go to a movie. Then let's go on vacation, right? Just how things happen. Then you just go more experiences and they become very solidified. So your relationship with your wife or your girlfriend become very, very strong. And that's how this whole thing got. I said, I can teach this much better than any other franchise on the planet. But I've gone very organic, very slow. I haven't really put any energy in sales or marketing into the physical therapy. It's just been very organic growth. And that's where we ended up now, selling franchises and supporting physical therapists.
Yeah. So tell me a little bit then. Well, I'm going to circle back on the relationships thing, but tell me a little bit about physical therapy now. Who are y'all? What do you do? Locations, all that kind of stuff.
Yeah. So physical therapy now started about 5 years ago, 2016 now. And we have about 45 locations across 3 states, Texas, Arkansas, and Florida. And we try to go into the easy registration states and states that you don't have to be a physical therapist per se to own a physical therapy center. Some of those states are harder to navigate. You can still do it, but you have to navigate some management agreements and the stuff. So we've gone to 3 easy states. Florida is my backyard, so I wanted to grow organically. Like I said, I haven't really put a lot of sales, a lot of effort into the sales because I wanted to really understand the first, 3-4 years of who do I want to sell to? What are the challenges with selling franchises? Because I didn't know about franchise, the industry itself. It's a giant industry. It's an amazing
Yeah.
industry. But I figured out some of the challenges, which were, sometimes whether it's a physical therapist or an entrepreneur that wants to get into this business, their mindset might not be right. This business might not be for them. They might think that they want to go into this business. But when it comes down to it, I've had franchisees that said, Andy, I love you, but this business is not for me. I said, well, why not? Well, I don't want to deal with patients who are in pain and it hurts my feelings. I don't want to deal with this, so it wasn't for them. And I totally respect that. No judgment, no problem. It's just, this wasn't for you. So now what we do is we make sure that we do a very thorough interview. We have a conversation for about a month to 2 months before we even engage in an agreement, so that we are 100% certain, and the franchise is 100% certain that this is for them. We want to win. We only want to win. We don't want to risk anybody losing any money, and we don't want to lose anybody losing any time. And we for sure don't want to lose time with somebody that is not equipped to run a practice. So we look at certain things, and we've been able to grow the franchise very good. Our franchises are very healthy, very strong, and we bring a lot of new techniques that other physical therapy centers are not doing, because we get to think of how to grow the business, and what we think, what we say, we work on our business rather than in our business, right? Very famous. The E-Myth Revisited talks about that all day long. How do you work on your business, not in your business? Like, you got to get out of being the technician. You got to get out of being the physical therapist. You got to get out of being the biller. You can't do it all. If you do, I promise you, if you're doing the billing, the physical therapy, the scheduling, you're worried about the supplies, you're not going to grow. You're going to do 1, 2, you're going to get overwhelmed, and you're going to give up at 2 or 3 clinics, maybe even 1 clinic. So how do you get out of that? That's what we teach. We teach how to get out of that whirlwind, how to get out of the technician physical therapy role. You can still be a physical therapist and practice when you want, but you don't have to be a slave to the practice. And that's what we teach in physical therapy now. And that's where, we have a lot of back-end support. We have accounting support. We have marketing support. We have billing collection support. We created our own EMR system so that we can manage data and do things faster. And we can change on the whim. I can, today I did like 3 different updates to my software, things that are huge. So we have our own engineers, we have our own people that create software for us. And so that's why we're able to grow so fast. And now that I have the data component, now my franchise is going to go even faster.
Yeah. Healthcare analytics and data, it's the future for sure. It's awesome.
Yeah.
I think it's so important what you just said. I love the E-Myth. I think it's probably one of my favorite business books to date. I think I talk to so many physical therapists or occupational therapists that get out there and they start a clinic, and it's exactly like they describe in the book. They have like this just a freak out if one day it worked, like, I can do this better, I need to be doing this better, and they go start their own clinic, and they don't really realize everything that goes into it, right? The marketing, the payroll, the people need to get paid no matter what, and all the things that are not in the clinic treating, and that's really what they want to do, right?
Yeah.
So the importance of being able to pull yourself
growing
out.
Your business, or growing your business. Like, I have a friend who, he's one of the most amazing, I would say probably the best physical therapist in Miami. It doesn't work for me. This guy's amazing. And I see him working so hard. And he has a very good reputation. And everybody, all the Major League Baseball players from here go to him. And all the high profile cases go to him. And his ego gets filled every single time he gets a celebrity in there. And it's amazing. It's great. But you have no time, and you're not growing. You're getting a physical therapy business. Yeah, that's great. And if that's what you want, that's okay. There's no judgment. But if you want to grow a brand, if you want to really make money with and have all the time that you want, you can't be in there doing everything. Just plain and simple. You just can't.
Yeah, I think that's important too, like understanding what you want. I was talking to somebody yesterday, and he was like, I don't know if I want to, grow to another clinic or this, that, and the other. And I basically told him, I said, listen, like, there's nothing wrong if what you want to do. My grandfather is a vascular surgeon in Miami and then Ohio. Like, all he wanted was a place to see patients and to do his craft, right? And when he was ready to retire, he just basically let the lease go, closed up everything, and walked away. Like, he had no intention of building this thing and selling it. And that's one way of handling business, and that's totally fine. And then there's the other way, like you said, where if you want to scale, if you want to, increase that profit, build your footprint, that requires a totally different mindset than this is my craft and I'm just going to do this as a job basically until I retire, versus this is a business that I'm building and I'm going to add value to and eventually, realize some of that value down the line, right?
Yeah, an exit. Maybe it's an exit. Maybe I want
Yeah.
2, 3, 4, $10 million. And maybe that's my goal. So I can buy the house, buy the boat, buy the, commercial properties, whatever you want. But whatever it is that your goal, you have to understand it as quick as possible so that we can help you get there. And that's what we talk at the beginning. It's like, what is your why? What do you want to do in your life? If everything was perfect, what would you do with your, with your time? And so you're trading time for money. You're always trading time for money.
Yeah.
If I want less money, I put in more time. If I want more time, I gotta make less money at the beginning just to make more money at the end. So it's always an exchange between time and money.
Yeah. All right. Well, tell me a little bit then. Let's dive right in. Building relationships or building businesses through relationships. So you take a different approach to marketing than many. I think so. I work a little bit with folks on marketing, and everybody that I talk to says, I need the newest ads that are working on Facebook or Instagram. I need to see, which landing pages are converting better. How do I get Google optimized? Not that that's all bad, but that's where all the focus is, right? They want the new gadget, the new gizmo, the new thing that they can just sign up for and the patients are going to flood in. And that's not necessarily how it works, right?
No. Hey, listen, very good friends of mine are doing these AdWords stuff. So
yeah,
very important. I don't want to badmouth AdWords, Google, Facebook, Instagram, Twitter, whatever you want to advertise. I have a small campaign, tiny campaign. I do it just to like dabble in it and learn more and kind of test the market. But I probably 1% of my effort goes there. And, like I was saying, all business, if you remember this quote, this alone is $1 million tip. All business is built on relationships. All relationships are built on shared experiences. So the trick is, how do you build relationships? And there's a whole scientific mathematical formula that I have on how to build relationships. It's literally scientific. 1 + 1 = 2. It'll take me 4 or 5 hours just to lay it for you, and then to get you to do it, it'll take me a little bit more to push you to do it. But I will give you some of the mathematical equations here. Okay. So first thing is, how do you build a relationship? First, you gotta have a conversation. And in that conversation, there has to be an exchange of words where, your energy has to be right. Your body language has to be right. Your tonality has to be right. Your, most important, your questions. Because if you make this conversation when you're meeting somebody about you and about your practice, I promise you this.
Or what you want to get from them, right?
Or what you want to
get.
You're
going to send me some patients?
I don't even ask them for business. And they send me business. And here's the difference. The other day, I went into one of the huge clinics. One of my marketers says, hey, I landed this $1 billion deal. This guy has a $1 billion organization. And can you come in and just help me on this one? This was a really big deal for him. I said, you know what, I'll go. And I sit down and I say, hey, first of all, incredible organization you built. Thank you so much for giving me 15 minutes. And this was a 15-minute meeting. This was the CEO of a $1 billion organization. He comes and he says, oh, thank you so much. No problem. I said, listen, I know your time is valuable. I drop in with some acknowledgement and gratitude. And then I said, can I just ask you a few questions? $1 billion industry, 50 years. How'd you do that? And guess what the guy did? Started talking. Zero physical therapy, zero about me. And I just kept asking him questions about himself. And there's a whole formula about this, but this is what I'm going to tell you guys. Don't make it about you. Make it about the other person who you're talking to. Yeah. And let them talk, because they want to share their story. They want to feel that pride. They want to feel important. And if you do that, that 15-minute meeting went on for 2 hours.
Yeah.
And then he said, what do you do? And I said, oh, thanks for asking, And I kid you not. I said, listen, I want a contract from this organization to mine, He said, you got it, done. My marketer looks at me and says, that was magical. That was magical because I found out how to bring him value in the conversation. I found out what his challenges were in that conversation, and I provided value. And most of all, I provided him a space to speak about himself and what he's done an incredible job and the future of his organization. Within 30 seconds, I had that contract. He says to his COO, hey, please give Andy a contract. He needs it right now. Didn't even negotiate the terms, nothing. He says, done. Now, that was really good. That happens over and over and over and over if you use the right formula, if you use the right questions, and you have the right energy, you have the right empathy, the right idea of providing value first before you even ask for business. Because this is what everybody does. Hey, how are you? My name is Andy. I have a physical therapy center across the street, and I'd really like to get to know you and really get to your business. Somebody comes to me and says that, I said, dude, thank you so much. Here's my flyer. Yeah. Thank you so much. Here's your flyer. I'm going to put it here. Thank you. I'll keep you posted. And I do that with the secretaries, and I do that with the referral coordinators, and I do that with everybody because it's not about me. It's about them. What can I do for you? Without even asking for nothing in return. And so that's the first part of relationship building, is really finding out what's in it for them. What do they need? I have for example, I'm going to give you another $1 million tip here. What do orthopedics need? What do doctors need to send you business? What would they love for you to give them? Business.
Yeah.
They want business back. So why wouldn't you create a referral system or a landing page that says, hey, we have orthopedic doctor Georgia. All of a sudden you're getting all these leads and you say, hey, doctor, here's another patient. Here's another patient. Here's another patient. What is that orthopedic going to do to you? Holy crap, Mandy, amazing. Thank you so much. What can I do for you? Hey, just send me some patients. I do knees, I do shoulders. Send me some patients whenever you have a chance. They'll send you everything. So there's a lot of things you can do to get business from providers, from doctors.
Yeah.
And then I'm going to give you another scientific mathematical equation here. So a lot of people are marketing to patients, and that's cool. You're going to get a few patients, but now you're just marketing to that one patient where you can make $1,000 or maybe $2,000. But what if you step it up, and that's a level, and again, everything's a shared experience. So the patient has to have a shared experience. You want that patient to be very good, bring him 18 times. You'll see how he raves about your business. Because now your experiences have become 18 times, right? But you market to one patient, you get one patient. You market to one doctor, maybe you get 1,000 patients if you're able to develop that relationship. But what if you can market to somebody higher up? Who do the doctors look up to? Where's their ecosystem? Who do they hang around with? Maybe you market to a software company like mine. They say, hey, Andy, how many doctors do you have in your panel? Well, about 300. Okay. Well, can I hang out with you and get to know you so that you can introduce me to these people? So we start looking at people like ecosystems. Like, Rafi, you have an ecosystem. I want to tap into your ecosystem. How do I do that? Well, first, you got to develop a relationship, right? Start from the beginning. Then I'm going to provide Rafi some value. And then I'm going to say, Rafi, I'd really like to get to know all your clients. Or hey, listen, why don't we do this together? We create something together, co-create something together. And so you start doing that over and over and over with ecosystems. And now I go to associations like the Florida Medical Association, and I say, hey guys, can I speak on your stage? And I'm going to speak on your stage because this is what I know. I know this, this, and this. Or can I get your list? Or can I just set a booth in the Florida Medical Association meetings? Can I just hang around you guys? So guess what that does? That gives me access to 3,000 doctors that maybe have 1,000 patients each. And so when and then you start becoming that influencer. Same thing with the influencers on YouTube and Facebook, all these influencers. You tap into their ecosystem. And then all of a sudden, they have an ecosystem that you tap into. So I'm always looking at ecosystems to provide value so that I can get value from that ecosystem, whether it's a patient, and it's an ecosystem, whether it's a doctor, primary care orthopedic, whether it's a hospital. I tap into hospital ecosystems now because they have physicians that work with.
Exactly.
So we're always looking at ecosystem mergers Because when I talk about mergers, it's like, hey, yeah, I'm going to bring some value from the people that I know. You're going to bring me value from the people that you know. So that's the new form of marketing. The new, like, I think it was, somebody said this, I'm not going to mention the name, but somebody says, relationship is the new relationship.
You there, Andy? I think we lost you.
Capital is relationship capital is, yeah. Hey, I'm back. So I was saying, I'd rather have $1,000. I'm sorry, I'd rather have 1,000 doctors than $1,000. Plain and simple.
Yeah.
Because I have $1,000, have 1,000 doctors under my umbrella. I can build incredible things with them.
Yeah. Well, I think the important thing too that you mentioned was that you're not starting these relationships off with saying, I run PT clinic and I need PT patients. Like, you're starting with the foundational, basically what clinicians do, right? We bring a patient in and we ask, what's important to you? How's this affecting your life? What are your problems? And we're not taking that exact same system and putting it with the people who are going to be sending us more patients, right?
That's right. You think, oh, I have a physical therapist that says, they're going to ask me about knees and they're going to ask me about shoulders. No, they're not. Not if you control the conversation. So one of the things I teach is, like, you have to have control of the conversation. You can't be there not knowing what to ask. So there's a series of questions that we have that never fail, and you control the conversation. Nobody controls your conversation. You control the conversation. And how do you control the conversation? By asking questions.
Yeah.
It's plain and simple. This magical mathematical formula, it just happens all the time. And so these are some of the things we teach. Again, it'll take me 4 hours to teach you all the little
the ins and outs
elements, the elements that we call of having an important conversation. But I've shared a few of them that I think provide massive value to your listeners.
Yeah. Well, and I think the concept too of being Malcolm Gladwell calls in his book, which book was it? I don't know. I've read all of his books, but outline, maybe it's not Outliers. It's The Tipping Point. And he talks about connectors, right? And that person that might not just have their one little ecosystem or the one little circle, but they're connected to 15 different ecosystems, and the impact that this one person has, because, you over here, you might want to meet this person over there, and you become this funnel through which a lot of value gets exchanged, but also, hopefully some business too.
Reciprocate some business. Yeah. Because part of one of the elements is like, hey, yeah, I know a lot of friends that are givers. A lot of have my marketing executive, this guy before he came to me, but he's still one of the most amazing givers on the planet. Like, this guy will take off his shoes, his hat, his underwear, and give it to you if you need it. But he would never figure out how to monetize the conversation, because he would just give. Oh, don't worry, just give. So there has to be the certainty, the energy to be able to say, hey, by the way, I do this. Can we do this? Right? And some people fall apart in what I call step number 4, which is asking for the business. I don't know. I did everything, but I never asked for the business. I never was clear and concise and precise on what I needed and how they can help me.
Because, that's one of the big pieces that's missed, right? You build a relationship, and then you don't want to do that. Oh, who is it that calls it? That he calls it the turn in his conversation, in his framework. Like, you have to, at some point after you build a relationship, there has to be a shift or a turn that, okay, we've done all this, we've had this shared experience, and now let me tell you some of the things I'm looking for too, and maybe how you can help me.
Yeah. And sometimes you don't even ask for it. You just drive in, like, hey, can I share something with you? Of course, you're going to say, opens up their listening. In the next 30 seconds, you're like, hey, I'm really excited about this. Here's where I'm going. Be like, hey, I think I can help you. And you don't even ask for the business. You share your vision, you share your dreams, you share your energy with them, and they'll help you. It just, you have to have the right energy in mind.
Yeah. Awesome. Well, we're getting near the top here. I always end with this, and you already shared a whole lot of value. But if you wanted like 1 or 2 points for a listener to take from this episode and walk away with, what would they be?
Get out of the technician role. Get out of the day-to-day. If you're doing billing, if you're doing scheduling, if you're picking up patients, if you're doing therapy, if you're doing the notes, you're doing too much. And if that's what you want to do and have a salary or, have a one practice, that's okay. No judgment. But if not, give that to somebody else to do and start working on your business. Have some executive decision time where you're sitting down and you're thinking and you're planning out your day and you're saying, I'm not going to do this no more. Who else can I do? Who else can I do? I have a VA company out of Colombia that I created. Now it's in Medellin. That's where I'm from. And I have 30 people working for me out of the country that I said, you know what? They can do this. They don't need to be here for this. Oh, you know what? They can do eligibility from there. Oh, you know what? They can do authorizations from there. I'm not going to do this anymore internally. You know what? It's better price if they do the, answering the phones over there. It's too expensive in the US. Like, I cut my costs down incredibly by using my team over there. So again, if any of your listeners want to use my team, I'll be more than happy to present them to you. I have a lot of physical therapy centers using them.
Yeah, we just did an episode on virtual assistants and leveraging them in practices. It's awesome.
Incredible. So first thing, get out of the technician room. Second thing, learn how to build relationships. Learn how to build relationships. That is the new currency. Forget about chasing that one patient. Forget about chasing that ad or what's going to work, what's not. Yeah, just throw it out there, test it, play with it. But if you build a relationship, you have the business from that relationship. And maybe it's not a relationship with this person, but it's a relationship with this person that's going to provide me somebody else. So build relationships is the new currency. That's the name of the game. And that's what you should be practicing. How do you do that?
Awesome. Cool deal. Well, Andy, where can people find out more about you, about Physical Therapy Now, all of the places where they can click on and find you?
I'm on LinkedIn. I'm on Instagram. I'm on Facebook. I'm on a website, physicaltherapynow.com. You can send me I think that's how we met. Send me an inquiry through the website. So I get all the emails, all the inquiries to the website. If not, it comes to me. But you'll find a lot of information on what we're doing there. Some of the other stuff like the VAs and the software company, you got to call me directly. We'll hang out. I have a lot of time in my hands. I'm like, I have this incredible company, hundreds of employees. But you know what? I always have time for my colleagues, my dear physical therapists and occupational therapists. If they want to learn what I've done, there's no secret. I'm not trying to monetize this. I just want to provide massive value to everybody so we can all grow together. And then somehow, maybe sometimes, we can do something together.
Yeah. Awesome. Well, Andy, thanks so much. Have a good one, man.
My pleasure. Talk to you soon.
Well, I hope you enjoyed that conversation with Andy Zapata. He's just a great guy, isn't he? It's not very often that you find somebody who's doing as much as he's got going on. He's got a lot of irons in the fire, and he's still willing to give out his personal email address and chit chat and talk about business and stuff. It's one of those things that, especially when I was first getting started running my own businesses, it was very helpful. And I loved running into people like that because it can be very difficult, especially if you come from the clinical world. I know I've shared this a few times in different podcasts, and we've had guests talk about it, especially when it comes around hiring, firing, managing operations, that sort of thing, that it's very difficult when you come from a clinical background and your whole career basically has been in the clinic, treating patients, serving clients, all of that, to go and turn into a business owner, because running a practice, a healthcare practice, is a business, which means there are numbers involved, there are spreadsheets involved, unfortunately. Obviously, we don't want healthcare to become about spreadsheets, but you need to make sure the business is financially stable, that it's sustainable, that you're marketing, that you're growing, that the operations piece is in place so that you're efficiently delivering care, that you're managing people. It's funny, most of the time when I talk to clients, either consulting clients or speaking and engagements and stuff like that, one of the biggest things that clinicians turned practice owners will tell me is that managing people is the hardest part of every job. And I think managing people is the hardest part of any job, regardless of what your background is. People are funny things, but it's always nice to be able to run into people like Andy, for example, who've been through it before, been through it a few times, and able to share a little bit of wisdom. So hopefully some of that was beneficial. I think his piece about relationships being built on shared experience is something that translates over not only to referrals and generating new business, but also in the interaction between clinicians and patients, right? So think about what he said, that relationships are built on trust and experiences. For you, if you're running a clinic or you're managing a clinic and you want your staff to be able to build those relationships, you need to identify for those patients that are coming into the clinic, what are those experiences that are going to be shared by both the clinician and the patient coming in. Now, maybe it's broad, very high level. Maybe you're specializing in something like I just saw somebody's website that's all about golf performance. He himself was a golfer. He got injured, and now he runs a golf performance center. They do some exercise. It's a gym, and they've got physical therapy and I think chiropractic and some other things involved. But it all stems from this shared experience of being a golfer and experiencing an injury, particularly in their back, and that's what's limiting their ability to perform. And it's something that this professional is using in the marketing message, so that even before, again, we talk about it a lot in new business development and marketing strategy, like the touch points that are there before the patient is even in the clinic sometimes have a higher impression or have the ability to convert leads into patients. And leveraging something like that shared experience, especially if it's hyper targeted from content marketing perspective, can be very effective, right? So he gets this professional, this physical therapist, is getting a lot of clients that are coming and filtering through his website simply because they're searching something like back pain affecting golf, and they're reading about this physical therapist who himself had an injury, and now he's using his knowledge as a physical therapist to develop programs to help golfers improve their game, decrease their handicaps. I'm not a golfer, don't really know what that means. But and it's all in the marketing. And then I'm sure if you book an appointment with him, if you schedule a consult and you show up at his clinic or at his organization, at his training center, you're going to get stories about it. You're going to see reading material about golfing and the impairments that can affect golf and back pain and how his program helps you improve that. And all of that is super, super important in building that shared experience. And then when you're able to kind of leverage or tap into that shared understanding or value system, then when you get into the clinic, or the patient gets into the clinic or into the performance center, that experience then becomes an extension of the communication and the marketing piece that was in place that drove them into the business. So anyways, it's something interesting to think about. Yeah, that's all I've got to say about that. If you want to learn more about the show, what we do here, head on over to www.betteroutcomes.show. You can sign up for the email list. We will drop you a note every time we release an episode, which we do every other week for sure. The last couple months we've been hitting it hard because we've had a little bit of extra time over the holidays, and we've been doing every week. That'll probably taper off as we head into Q1, Q2 of 2023, but at least 2 episodes a month we're releasing. All of our guests are folks that are doing something great in healthcare, whether it be innovation in technology or service delivery, but the end goal is always humanizing healthcare, or making that human connection in healthcare felt, and then leveraging that to improve outcomes. So if that sounds like something you're interested in, head on over to www.betteroutcomes.show. Check us out, sign up, subscribe, all of those good things. There is something cool now. A friend of mine, Matthew Curtis, has started a company called Ask Answer, and it is a video question and answer service. So the way it works is if you have a mobile device, which I'm sure you do, you're listening to a podcast, right? Mobile device, you can go over to betteroutcomes.show, click the button that says Ask Rafi a Question. You can shoot me over a short video question, again, about anything around the show or the book, Better Outcomes, A Guide to Humanizing Healthcare, or about humanizing healthcare in general, or innovation in healthcare. And shoot me a short question. It notifies me, and then I can answer that question. It's a good way for us to interact. that's not just typing back and forth on a computer screen. You get some real FaceTime, so to speak. So check that out. Go to betteroutcomes.show, click on Ask Rafi a question, shoot me a question. Love to hear from you. Alrighty, and final plug. If you are a practice owner, you own a healthcare practice, and you want a system that leverages the human factors of healthcare to improve both your clinical and your business metrics, I'd love to talk to you. Head on over to rehabupracticesolutions.com. There's all kinds of buttons there that let you schedule a call with me, and we'll see if it makes sense to work together. Until the next time, folks, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabupracticesolutions.com. We'll catch you on the next episode.